welcome to Well Within Reach. Our podcast today, we have Dr. Janine Kyrillos. She is a diplomat of the American Board of Obesity Medicine. She's an associate professor of medicine at the Sidney Kimball Medical College at Thomas Jefferson University, and she is the enterprise medical director, the Jefferson Comprehensive Weight Management Program. So we're so excited to have you with us today. How are you?
That sounds like a lot. I'm great. How are you?
I'm good. So, Dr. Kyrillos, we're just going to dive right in. I mean, everywhere you turn, everywhere you go, the weight loss is where it is right now. I want to come to your weight loss management, your comprehensive weight loss management center. Who's a good candidate? Should I come? What should I do? I want to lose weight. I've been struggling my whole life.
So we welcome anybody. You might be a normal weight now, but you just lost weight and you want to maintain it. You may have been a low weight and now you hit menopause and you've gained 10, 20 pounds and you feel terrible, but your weight's not that high. Or you've struggled with overweight and obesity, now or for a long time, and we want to help you manage this medical condition, this disease of obesity.
Yeah. So, tell us about what happens at the center when you come? What's the process?
I don't know, where do you want to start? When you schedule an appointment, we try to get, our weight is down to about 1 to 2 months, which is much better than it used to be. So you can call to schedule an appointment, you can schedule online, and then you'll come and meet one of our clinicians, either a physician or a nurse practitioner or a PA, and we will go through a thorough history to understand your medical conditions, any medications that you're taking, any other conditions, what your goals are, what you're trying to accomplish. And then we'll talk about, what's been happening, how we can help you, how, maybe there are different ways to eat that'll make you feel more satisfied. There are medications that we can go over. We may, even talk about referring you to a surgeon for bariatric surgery. And then we also, we have a dietitian team, and we have, classes for our patients, nutrition classes. We have behavioral health referrals. So you want to talk to somebody about habit change, things like that. So we really have a lot of resources for patients.
Well, that's nice to hear, because I think a lot of people, with everything going on in the media, social media, we're seeing a lot of the celebrities who are, looking amazing, lost all this weight. And I think everybody thinks it's just, get a shot or take a pill and, voila, you're going to be looking just like them. But it sounds like it's a lot more to it than that.
Everybody is individual, and you're only going to see the patients or the people that are successful, that lost, 100 pounds. You don't hear about the patients that are struggling, the everyday patients that are really trying to figure this out and trying to treat this disease. And there are a lot of, you can't just take a shot. You've got to take a shot and look at your other health issues and change lifestyle. It's a whole package.
So the title of this podcast, we called it Food Noise, and thinking about food all the time. So what does that look like in a person's world, when they're thinking about food all the time? What does that?
Yeah, it's this that phrase seemed to have been coined since the GLPs came out, and people realize, like, it's noise, it's constant noise. I'm always thinking about food, thinking about what I'm going to eat next. Thinking about what I last ate, feeling badly about what I last ate. It's sort of, so for some people, it can be an obsession with this food, and it's really tough. And we're learning that there are signals in the brain that are making us think this way. It's not just, I can't control myself and all I do is think about food. And, our brains want to, we don't want to starve. Our bodies don't want to starve. So our brains are revved up to be thinking about where to get food next. And it's not always productive.
Yeah, that is right. Well, you mentioned GLP-1, so you gotta talk more about that. What
Um,
are they? Who's a good candidate?
yeah. So
Just tell us all about it.
GLP-1s, glucagon-like peptide 1. So these meds have been out. Actually, the first one came out over 20 years ago. So they're not brand new. They've been used for diabetes for years, and newer ones came along. But they realized that not only do they treat diabetes, but people lost weight. Um, and so then they began to tailor them toward weight loss. Um, and because they're really effective in helping with weight loss and helping to control that food noise, they become very popular. So who qualifies? Um, Officially, medically, um, people that have, so a body mass index. Are you familiar with that term? It's a calculation using your height and weight, and somebody with a body mass index of 30 or above, or if they have a BMI of 27 and an obesity related complication like blood pressure, arthritis, sleep apnea. Um, there are a lot of different things. Um, so 27 with a weight related condition or 30 medically qualify for this medication. Um, and now it's not as easy. Sometimes insurance companies have a lot more restrictions. There's costs, things like that. But it's funny, if you look at the general population, about 50% of the population actually qualifies.
Wow.
But of course, as a society, we can't afford to put that many people on these medications.
So what do you see is the future now that it's like this explosion of folks getting these meds? It seems like you can go on the internet and order them almost. I don't
Yeah.
know, but it just seems like, everybody's saying, ask your doctor for them or go get them. So
Yeah.
what do you see happening in the future for these meds?
It's a really exciting time. We're kind of figuring out the best way to approach this, you know, who should manage it. I'd be very careful about ordering online. There's a lot of sort of knockoffs. They're compounded medications, and they try to mimic the brand name medication, but you don't know exactly how they're making that product, what they're putting into it. A lot of times that they don't dose it properly. It ends up costing more than if you just gotten the brand name product. So I'd be careful about that. Your primary care provider often are comfortable prescribing it, but they're still learning some of the nuances. So you may hear, because I just heard today, a patient said, "Oh, well, my primary care doctor said, I should be able to do this myself." Another one said, "Oh, my PCP said I shouldn't be taking this medication long term, so I should be stopping it." So there are still sort of some older thoughts from physicians that are not aware or comfortable. Some primary care providers don't know how to dose it properly, so they just put them on the low dose and say, okay. Some ramp right up to the high dose and don't pay attention to side effects. So those are the people that struggle. But there are a lot of primary care physicians and other specialists that know how to do this and do it well. And then, of course, there are specialists, weight management specialists like myself and my team, that specialize in this and really can guide you to the right direction.
Well, I got to ask a little bit more about that. Have you seen any really substantial long-term complications?
I really haven't.
Okay.
There's a lot of sensationalism online. People talk about stomach paralysis and cancer, but again, these meds have been out for over 20 years. They're very safe. Most patients, if they're going to have, bothersome side effects, get them fairly early on. And then there are things we can do to, play with the dosing, recommend more fluid intake. Sometimes people just need to drink more, maybe adjust what they're eating. So there are some, tricks we can do to help them tolerate these meds. But there are some people that can't tolerate it, or they'll get more serious side effects, just like any medication.
All right, that sounds good. So, how about if you're a person who doesn't really want to take a lot of medication or take any medication at all? Is it possible to come to the center and be successful?
Yeah, I mean, we definitely try to work with patients to talk about how they're eating, what they're eating, their lifestyle that may be triggering their weight. We have different, um, different approaches to help people learn more about their body and how they respond to different things. And actually, we just are launching a new lifestyle medicine program um, that's separate from my group that are focusing just on lifestyle medicine, and that's not just for people with excess weight. That's for anybody that wants to improve their health through lifestyle changes. So they look and help with nutrition, um, movement, sleep, stress, social connections, smoking cessation. So they go into a little bit more depth with like weekly classes for patients. So that's another option that we're really excited about at Jefferson.
That sounds exciting. So, give us sort of your summary, if you will, of the state of weight management as it is right now. What advice do you have, or what do you have to say to folks who are trying to figure this thing out and trying to figure out what they should do, what steps they should take to get started, that
Um,
push.
yeah, yeah. First and foremost, what I really want to have everybody understand, including healthcare professionals, is that patients are really trying hard. That this is not your weight is not your fault. There's so many factors that are working that make it working against you really, but that make it really difficult. Things in the environment, things in genetics, the medications we're prescribing, the food quantity and quality, the stress levels. It's really difficult. So be kind to yourself. Understand that this is not just on you. I mean, there we want to engage with you. We want to work as a team, but we're looking at excess weight and obesity as a chronic medical condition, a chronic disease.
Yeah.
So if you had diabetes, you would find a doctor or a provider that could help you address this condition. So this is the same thing. If you had asthma, you would go find somebody that could help you figure out how to address it, how to treat it.
Well, I think that's some good advice. And we really appreciate you being with us today. Again, this is Dr. Kyrillos, and she is the enterprise medical director for the Jefferson Comprehensive Weight Management Program. And for those of you who are looking for some opportunities to get some help with your weight management, you've been on that journey, you may consider, looking into the center and all that it has to offer. So, Dr. Kyrillos, I just want to thank you for all you do for so many people tirelessly, just out there helping folks and providing them with information, education, and resources. How much we appreciate you spending time with us today. And I'll just give you the last word.
Well, thank you. I appreciate you, and I appreciate you for having me. Um, it's an exciting, changing time. There are new meds coming out. We're understanding the older meds. We're understanding getting them covered. So right now it's hard, and they might be expensive, but hang in there. We're gonna, you know, we're gonna really launch into a new phase, a new world in terms of obesity treatment, weight treatment, lifestyle, um, health. Um, health.
All right. Well, thank you so much.
Thank you for having me.